itself, my presentation is strategic environmental assessment process for addiction and substance use disorder, ASUD, mitigation centers towards sustainable environmental addiction medicine, behavioral health, and psychiatry for sustainable development. And this particular topic which I have taken to conduct the environmental impact assessment for the addiction industries, that is defined as the systematic identification and evaluation of the potential addiction environmental health impacts of the proposed projects, plans, programs, policies, legislative actions related to the psychological, human mind and function, physiological, physical, chemical, biological, cultural, and social economical components of the total environment. This particular topic is concerned to the addiction. That is, a person addicted to some substance depends upon the substance and their activities and their events. So that has been systematically identified, and their problems have been identified, and that problem have been mitigated in by using this particular strategic environmental assessment process. So strategic environmental assessment process is the systematic identification and evaluation of the potential addiction environmental impacts of the proposed projects. So many of the centers, they have not considered mostly the environment and sustainability in their organizational planning and decision making process. That is environmental and sustainability. Suppose if the addiction is not considered the environment and sustainability, then that will have the environmental effects, that is the impacts that will take place. That is called the environmental impact assessment or environmental health impact assessment or psychological health impact assessment. So that is that has been identified in mostly in nuclear power plants. Nuclear power plants have a lot of the emissions with respect to the alpha, beta, gamma. So such kind of environmental pollution, how for example Queensland National Power Corporation, then the various in China. So the toxicological effects have been assessed in order to understand the psychological health loadings on workers and nearby residents. Nanotoxicology resulted as 1000 millionth standard order to neurosis and psychiatry towards sustainable nanotoxicological development. The strategic environmental assessment process must be needed for making much earlier decisions in planning and decision-making process than EAA process. So this is a systematic identification, and the pH negative logarithm of hydrogen ion activity has been measured, monitored, and controlled in air, water, and land environment. And the negative logarithm of hydrogen ion activity less than 2 and more than 14, they are considered as a hazardous substance. In USA, nearly around 12,000 billion tons of solid waste generated from the substance, and out of that nearly around 10% is the hazardous substance. For example, if you take this current COVID-19 situation as on date, India is confirmed death is 5,28,429. Japanese environment, it is confirmed death is 25,792. You see the large difference due to the environmental quality. That environmental quality is very excellent in Japanese environment compared to India, because here we are not able to properly focus the hazardous substance. The hazardous substance is the toxic substance waste is defined as any substance, maybe alcohol or it may be tobacco, which because of its quantity, concentration, or physical chemical infection characteristics that may cause or significant contribution to increase the mortality rate. The mortality rate is speak here. That is a concern to the Indian environment and Japanese environment. And the addiction is or cause the increase the mortality, increase in serious irreversible or incapacitating reversible illness, or pose a substantial present potential hazard to human health and environment when improperly treated, stored, transported, or disposed of, or otherwise managed the hazardous waste and hazardous substance. So the neuroscience and psychiatry soft matter need to be neutralized in context to the blood or in context to the any the organs, human organs in the body. Because the pH neutralization, negatively charged particle always repel each other. Positively charged particles always repel each other. So repulsion means it is a stable condition. So most of the drug addictive people, they are always in stable condition. Why the stable condition is? It is due to the perikinetic and orthokinetic particles. They always repel each other. But when we add the dose, that is the addiction dose. So it is going on attracting each other and become a flux and coagulation dose and get settled in our as a sludge. Sludge has 99.9% is the water and 0.1% is the net solids. So the negatively charged particles always repel, and positively charged particles always repel, even in case of blood also. So when we add the dose, medicinal dose, and it get destabilized perikinetic and orthokinetic particles and get settled. So this is a very simple theory about the addiction. So when we conduct this theory, that is the addiction theory, then it is easily possible to consider the organizational planning and decision making process, especially addiction centers, mitigation centers, adaptation centers, which will consider the environment and sustainability in their organizational planning and decision making process. Because the optimum dose is very important. The optimum dose of the coagulation dose is very important. So the EIA process is to encourage the considerations of the environment in addiction, industrial, source specific and generic project planning and decision making process, and to ultimately arrive at actions which are more environmentally health compatible, psychologically health compatible, and physiologically health compatible. So these are the various components of the environmental addiction industries, like environmental air environment, that is environmental addiction air environment, addiction surface water, addiction soil groundwater, addiction noise environment, addiction biological environment, addiction cultural environment. One is a natural addiction, another is a man-made addiction. Architectural, cultural environment, impacts on archaeological environment, impacts on the visual impacts, as well as the social economical environment. And this is a process approach, how this addiction should be controlled by means of the addiction resources. These are the resources, various addiction resources, which are transformed into the output, addiction output among the addictive people. And this have considerable loss function, and this have the environmental toxicological effects, which are measured, monitored and controlled by means of the process approach model. Output by input is equal to efficiency, and the effectiveness means ability to achieve the desired result. For example, ethyl alcohol. Ethyl alcohol has a poison ratio, poison number of nearly 3.5. So negative logarithm of lethal dose 50% test organisms, that is concerned to the industry 4, generic 4, source specific 4. So that loss function deployment is considered in this particular approach. So that is very important in the case of the addiction centers and mitigation centers as well as the adoption centers. So Dr. Vijayan Gurumurthy Iyer techno-economical environmental study and check has been conducted. About 85% of the addiction disorders and or disease accidents are preventable. And the strategic environmental assessment process in addiction clinics, de-addiction centers. So the potential impacts of the proposed projects, plans, even legislative actions, policies on the environment and sustainability. The SEA process is designed and developed to identify and predict the potential health impacts of the psychological, physiological, physical, chemical, biological, ecological, radioactive, social, economical, cultural environment, and human health and well-being are adequately protected. So if you consider this systematic approach, that is the environmental addiction health impact assessment process, about 85% of the addiction disorders and as well as the disease accidents are preventable. So this is the very important preamble, and because mainly this is due to the climate change, as the temperature entropy, that is the measure of the entropy, sea level, precipitation, droughts, floods, So this is a root cause for the adaptation and the human health impacts of the different biodiversity aspects, adaptation and social economical aspects. So it is, the temperature has been increasing from minus 19 degrees centigrade to presently 15 degrees centigrade. So nearly 34 degrees centigrade increase from the pre-industrialized period to the present period. So it means the mitigation has not been there in the addiction centers. So for mitigation, the sustainable development can be targeted, which is a development that meets the needs of the present generation without compromising the ability and the efficacy of the future generations to meet their own needs. For example, the environmental health impact assessment of nuclear power plants. So there are more than 400 nuclear reactors are available in the world, and most of the reactors have the psychological people effects, the psychological disasters. The reason is the psychological health impact assessment has not been done. So that is why the mitigation aspects are the problems. Why mitigation in these centers are not able? Even America, lot of clinics, addiction clinics are available. Their mitigation is the question, because they are the hazardous substance, they are toxic substance that has pH, it has pH of more than 13, alkaline hazardous waste, and less than 2 pH 2 acidic level. It is as a hazardous acidic substance, most of the medicines. So they require the optimum dose calculations. See, if the patient is given more than the optimum dose coagulation, that also it has the problem, because it is overdose. If it is less than that, then that also will not able to treat the patient. So optimum coagulation dose is a must. So that determination is very important for the environmental health impact assessment. See, most of the nuclear power plants in the world, they do not have the system of conducting the psychological health impact assessment. Psychological health impact assessment is a systematic identification and evaluation of the potential psychological disasters which are taken place nearby the where the nuclear power plants are located. And this require the environmental health impact assessment, but most of the nuclear reactors, they do not have the proper the environmental health impact assessment process, by which we will able to mitigate the psychological health impacts of the nearby many projects that requires the psychological health loadings. So negatively charged particles are always repel. So it is a stable formation. The stable formulation of the addictive substance as the substance use of disorders. And this always perikinetic and orthokinetic particles, they always repel, and it is a stable condition that won't settle. The people always remain in that stable condition. And why? Because they are always repulsion in nature. But optimum coagulation, when you are given, the dose is given, that is LD50, negative logarithm of LD50 test organisms, 50% test organisms, then it will be effective dose for the patients. Efficient dose means output divided by input. That is equal to efficiency, dose efficiency we call. Dose efficiency, we will be able to control the loss, and we will be able to mitigate the patients, because the dose is given correctly, so it will automatically the tuberculation and incrustation, that is the pH maintenance, the negative logarithm of hydrogen activity, pH maintenance in case of neuroscience and psychiatry soft matters, it is a must, because hazardous soft matter is anything having corrosiveness, pH less than 2 and more than 2 to 12.5. It is acidic and alkaline, and such matter should be neutralized. So it will become destability. After the coagulation dose is added, it becomes destability of the perikinetic and orthokinetic particles, and they going on, settle by means of flocculation as a solids and get neutralized. So this way, the effective and efficient dose determination in case of this, molecules, because of the substance use poisoning, they call substance use poisoning. If it is controlled to 0.1 ppm, then it is acceptable limits. But if it goes beyond the 0.5, 0.1 ppm, and it is more than 100 ppm. So 100 numbers we called it is addiction number, addiction substance number. So if it is more than 100, then it will become carbon monoxide poisoning, or it may be tobacco poisoning, or it may be considered as a ethyl alcohol poisoning, or coffee poisoning, caffeine poisoning, botulinum toxicity. If it is more than 100 ppm, botulinum, diphtheria toxicity. So this is concerned to the industrial toxicology studies, as well as generic toxicology, as well as source specific toxicology. And they have the toxic extraction leaching procedures, TLP waste extraction test has been conducted, and in order to assess the characteristics attributes with respect to the ignitability, corrosivity, reactivity, and toxicity of various substance. The various substances are given here, and the substance are almost I'll just show you the substance. Okay. Yeah. So the toxic hazardous substance which I have shown. So this need the proper dose. The important of the conducting study is to identify the proper dose given to the patients to get destabilized from the conditions, because they are already in the stabilized condition, but it should be destabilized. So we have a laboratory. In that laboratory, the coagulation dose, especially the addictive medicine, is determined. It is called the sustainable medicine. Sustainable medicine means the medicine that meets the needs of the present generation without compromising the future generations to meet their own needs. So this is concerned to the the carbon monoxide poisoning. Similarly, the symptoms about the carbon monoxide poisoning and the various disease upon the dose 4%, 10 to 20%, 20 to 30%, 30 to 40% headache, and coma stage is 50 to 60%, nearly 100 ppm upon the exposure time. And the various food poisoning and heavy metal poisoning, carbon monoxide poisoning, radon poisoning, chemical poisoning, botulinum toxicity, this has been systematically identified by means of the law of conservation of energy and conservation of mass. The materials generated is equal to materials recovered plus discard. So the energy can neither be created nor be destroyed, maybe transformed from one form to another form. Total energy in universe is constant. So trauma, which is responsible to a deeply distressing or disturbing event and activity that overwhelms an individual ability to cope up and diminishes their sense of self and ability to feel the full range of emotions and experiences. So acoustics trauma has been investigated. For example, the high pressure noise level nearly around 120 dBA. So the psychological effects, how it has. Chromium pollution toxicity. And this is the mu. Mu is, for example, the effect of climatic change on the microorganisms. The effect of the microorganisms on the human being upon the poison number. That is a negative logarithm of, the lethal dose, 50% test organisms. So mu is the maximum growth rate, and S is the limiting nutrient factor. So limiting nutrient factor, whatever the substance use addiction, that has the limiting nutrition factor, and the maximum growth rate. Even if you drink any beyond the particular limit, it won't absorb in the body because it will come out. So that is called a limiting nutrient factor. And this depends upon the substrate utilization rate and the growth rate. So the addiction there, it is in a stable condition. It has to be now destabilized or destabilized. So that is why the coagulation dose have to be optimum, the best optimum coagulation dose. For example, these nuclear power plants, the mental well-being impact assessment, that is a very important tool to identify and evaluate the potential mental well-being effects of any industrial projects or generic projects or source specific projects. So the people who are exposed with this lint cotton bisonosis, as well as the synergistic poisoning, it is called augmenting poisoning. The augmenting poisoning has been modeled out in my research paper, and that has been published here. So cotton disease bisonosis, and cotton dust and bisonosis and chromium specific dust. So it has synergistic during the daytime and dyssynergistic during the night time. So they are always in a in a stable condition when the temperature increase, because it has connected to the temperature, air movement, humidity, and the air movement and temperature and the water particles and dysenergistic fact, photo energy, dysenergistic facts and synergistic facts. Nighttime it is dysenergistic facts, and daytime it is a synergistic facts due to the EMI interaction, electromagnetic electromagnetic energy interaction interrelation. You can see that incident solar radiation is equal to reflected solar energy plus absorbed solar energy plus transmitted solar energy. So microscopically also it has elastic, vibrational, translational, relative and interrelative. So this transmittivity, absorptivity, and the reflectivity is equal to 1. So in this, the particular psychological health impact assessment has very important considerations in these 437 operable power reactors in the world, that is nuclear power plants. But the most of the nuclear power plants do not have this problem of environmental health impact assessment. Why? Because the nuclear have very dangerous disasters, especially the people working in the vicinity as well as the nearby residents, and they get about the psychological effects because of the alpha, beta, gamma radiations. Because of the alpha, beta, gamma radiations, this has, so this is a cocaine addictives, P1, substance abuse, P3 is a trauma, P4 is a drug addicts, P5 alcohol addicts, and P5 anesthetic, LD50, lethal dose 50% test organisms. So have the synergistic effects. Synergistic means it is a combined, each one has cooperation in the atmosphere, and it has the combined effects than the individual addicts like cocaine or substance. So synergistic augmenting effect, the P5 is a synergistic pollutant, or say the poisoning effects, addiction synergistic poisoning effects is 100 ppm. So it is nothing but the coma stage. So this this is a very good climate change model, especially in context to the addiction, optimization and modeling diagram. So which shows the considerable environmental and sustainability effects of the addiction synergistic poisoning effects. And accordingly, the drug model is developed. So in this particular case, 100 ppm, there is no medicine available. For example, photochemical smoke occur in Los Angeles. There was no there was no medicine at the time. But now in this particular augmenting, synergistic and dysynergistic simultaneously take place. That is a heating and keeping it for some time and cooling and at a particular rate. So it is called the poisoning effects. So this is a deoxygenation and reaeration which take place upon the addiction professionals, addiction of the substance disorders. So always this deoxygenation take place. The point at which the deoxygenation rate is equal to reaeration rate, the particular patient is in a highly the health of the particular patient is very poor, and his mental condition is very poor, and it is due to the deoxygenation rate. The dissolved oxygen come down, it is the minimum level from the maximum saturation dissolved oxygen level from 7.8 mg per liter to 2.1 mg per liter, and again the reaeration starts. So this is a stable and unstable conditions occur in the addiction personnel, and that is why this SAG model, the oxygen SAG model, has been designed and developed in this particular paper research abstract. And so the poisoning take place, it is primary poisoning, secondary poisoning, and tertiary poisoning. And these are the references I have given. So for example, nuclear power plant has been investigated. So the World Conference on Psychology and Sociology has been documented by the Academic World Education and Center. And this paper is concerned to the coronavirus impact assessment towards the sustainable development. which is a development that meets the needs of the present generation without compromising the ability and efficacy of the future generations to meet their own needs. And this is the WE, waste electrical and electronic equipment. So this has the considerable psychological effects on the environment, which I have shown in the picture. And environmental health impact assessment for the nuclear power plants have been investigated and documented. And this is the environmental health and safety aspects addressed in one conference. And this is the strategic environmental assessment process, where the environment and the sustainability, that is the ability of the system without damage to the environment for sustainable environmental biology, pharmacology, and toxicology, including the music therapy towards the sustainable development, has been proposed. And the publisher is Ville Black. And the other references are keynote address have been given for the strategic environmental assessment process for sustainable environmental neuroscience and psychiatry towards the sustainable nanotoxicological development. And in Beijing municipality, a virtual conference program book, international conference on basic and clinical pharmacology and toxicology, international conference on medicinal science and biological engineering, international conference on biomedical engineering and health science, international conference on bio informatics. Publisher is Willow Blackwell. And these are all the another important publication on the nano toxicological development. And this conference concerned to the the natural science and engineering. And this is the paper concerned to the pharmacology, toxicology, and musical therapy. And the Charles Darwin said on the origin of the species, that's not the strongest or most intelligent of the species that survives, but the one that's most adaptive to change. Thank you, one and all. Thank you, one and all.